Hey guys, my name is Aaron and I'm a third year medical student from the University of Adelaide. In today's video, I'll be covering my general approach to the Situational Judgement section of the Ucat examination, and I'll be going through a few questions that focus on the different areas that this section covers, specifically confidentiality, professionalism, and integrity. So just like my previous video on verbal reasoning, I'll be getting my questions from the free question bank that you can find on the Medic Mind UK website, and I'll leave a link for that in the description. And I'll also link some resources for the General Medical Council, which also covers confidentiality and all that stuff that you cover in this section. So before we start, I'll also put some timestamps for stuff which appears in the video, and just feel free to skip around the video to the pieces that you want to watch. So this is the Medic Mind Ucat website. We'll just scroll down to Situational Judgement. So you can see here that it has confidentiality, professionalism, and honesty and integrity, and specific questions for each section. So I think we'll start with professionalism. So I've got a few tips before we start these questions. So tip number one is, so in the scenario, there's lots of different scenarios that you'll encounter, but tip number one is to try and solve any issues at the local level rather than immediately escalating it to like management or higher levels. Another is the fact that patient safety and comfort is an absolute top priority. So any action that preserves patient comfort or dignity is almost always like a really good option, so almost always completely appropriate. And vice versa, any action that reduces patient dignity is completely inappropriate. And another tip would be that so a top priority of a medical professional is to make sure that the public perception of healthcare is maintained. So anything that can jeopardize how the public views the healthcare system is completely inappropriate as well. And probably a final tip would be to understand that in lots of these scenarios, you're a medical student, and as a medical student, there's lots of limitations because you're still in training. So if a certain question asks you if you can give medical advice to a patient, the answer depends on whether you're being supervised by a qualified doctor or not. So that being said, we will start the professionalism questions. Alright, start test. We'll get some extra time just for the video. So we'll do a couple of questions from this section, then we'll move on to the other sections of confidentiality and integrity. So, let's read it out. A group of 5 second-year medical students are undertaking a group project which forms part of their grade. One of the group members, Alex, has turned up 20 minutes late to their third team meeting. He's been late to every single meeting. So Sarah, the team leader, is becoming slightly frustrated as Alex's lack of punctuality is disrupting the group's progress. So how appropriate are each of the following responses by Sarah in this situation? So, response number 1, report Alex to the tutor. So, okay, so like I just said before, so this is like an immediate escalation to a higher level. So what I just said before is that you want to deal with issues locally before you escalate it. So in this case, it's probably a very inappropriate thing to do because you haven't even attempted to solve the problem on your own. So next question. So speak privately with Alex and ask why he is turning up late. So this is basically the opposite. So this is dealing with the issue at a local level, which is a very appropriate thing to do. So number 3, so wait and see if Alex turns up on time for the next meeting. So I'm bordering on C or D, because it's almost like you're not doing anything. I might go with C in this case, just because, so you're not immediately escalating the situation, but then at the same time, you're not really solving any problems either by just leaving it. So I'm going to go with C. Okay, so this one is speak to other group members and ask for their advice. So asking for advice is often a good idea. But at the same time, so I might go with B in this one because, yeah, so asking for advice is good, but then by bringing it up with other people in the group, you might be like isolating whatever this guy is, Alex. You might be isolating Alex as a result. So yeah, it's appropriate to seek advice, but it's not ideal because you might make Alex feel uncomfortable. So we'll go with that. And number 5, send a group text message to remind everyone of the importance of turning up on time. Okay. I might go with C on this, just because, so you are trying to solve the problem at a local level, which is good. But then at the same time, you're not being very specific, and it's probably not going to solve the problem that is happening right now. So it's not completely inappropriate because you are dealing with it at a local level, but it's not that effective either. So we'll go with C. Okay, next one. So James and Kim are 2 fourth-year medical students currently on their hepatology placement. James is making TikToks on the ward, sometimes in the view of patients. Some of the TikToks are making fun of patients talking about alcohol use. Kim can see that some of the patients are looking uncomfortable, and she feels that James is acting in an unprofessional manner. So how important are the following considerations? So the fact that the patients may be feeling uncomfortable. So yeah, like I said before, patient comfort, dignity, and all that sort of thing is top priority. So that is a very important consideration because you do not want patients to feel uncomfortable. Number 7, that reporting James might jeopardize his degree and future. Okay, so in this case, it's not important at all, and that may seem pretty harsh, but yeah, most of these questions, if someone's doing something wrong and it jeopardizes how the patient feels, then it's like it's a professional obligation to report that person. So that's all mentioned in the General Medical Council guidelines. And the guidelines are pretty similar in Australia as well. So number 8, that she feels that James is being unprofessional. So how important is this? Yeah, I think that's pretty important. I guess it's not very important because sometimes it can be like a matter of opinion if someone's professional or not. So number 9, that James is filming TikToks on the ward. Yeah, so I might go with TikToks specifically on the ward. So that's important. So I'm going to go with very important in this case. I mean, it doesn't really matter. So you have to always be careful with things that you do in the public and things that you do in the private, because it can affect how people view the medical profession. So yeah, the fact that he's on the ward and he's filming TikToks and the TikToks are making fun of patients who have alcohol use, and it's in full view of the patients, it's a pretty important consideration. So I'm going to go with A in that case. We'll do one more question. We don't want to make this video too long. So Jacob is a first-year medical student and he's currently living in a student accommodation. So following his exams, Jacob decides to host a party. At around 2 a.m, the police are called due to noise complaints. When the police arrive, they find a small quantity of cannabis and ketamine in his room, and Jacob is arrested for possession of a controlled substance. The next morning, Jacob is charged for drug possession and released. He is unsure whether he needs to inform the medical school. So how appropriate each of the following responses by Jacob in this situation? So statement 10, never inform the medical school of this drug charge. So automatically, this is a very inappropriate thing to say. So the guidelines state that if something like this happens, it's a very important consideration to immediately inform the medical school, with the key word being immediately. So we're going to go with very inappropriate for this question. So not inform the medical school unless found guilty. I'm probably going to go with D as well, because yeah, key point is if something like this happens, it's to inform the medical school straight away. So yeah, very inappropriate in this case. So number 12, seek advice from a medical defense organization. So I'll probably mention this later on, but seeking advice is almost always the best thing to do. So we'll go with a very appropriate response. Question 13. Immediately inform the medical school of this drug thing. So automatically, I'm going to go with very appropriate in this case because you're following the guidelines. So you are informing the medical school, which is a good thing, but then you're waiting until the start of the next semester in order to do so. So, yeah, it's appropriate to inform the medical school, but it's not ideal to do it this late. So I'm going to go with question B. Yeah, so we got low band. Oh, we got band 1 still. But yeah, we didn't answer some of the questions. Oh, we got most of them correct. Here we go. Let's see what they said here. So I got lots of thumbs down on this one. People must have been annoyed. Yeah, there we go. Correct answer is D. Yeah, should try. Sarah is unnecessarily escalating the issue. Should always address the issue before escalating it further. All right. I think we should do confidentiality next. So I've got a few tips that I wrote down for confidentiality. So tip number 1. So in almost every case, maintaining patient confidentiality is a very important consideration. So any action that maintains it is very appropriate. Number 2, it is inappropriate to break patient confidentiality to people who are not directly involved with the care of the patient. So, for example, even if you were to tell like a doctor or a nurse about the patient, this would be inappropriate if they're not not involved with their care. Another tip. So the only time when it's appropriate to break confidentiality is if the patient is a danger to themselves or a danger to the public, or if it's a legal requirement for you to do so. For example, if someone has like a notifiable infectious disease, they may need to notify SA Health, for example. And I think another thing, I covered this in a couple questions a few days ago, but drug use is like a very common thing amongst a lot of patients. So, and you ask about drug use in basically every history that you take. So even if the drug that the patient is taking is illegal, it'd be inappropriate to report them to the police because one important consideration is to uphold the doctor-patient relationship, and by reporting the patient to the police, you're breaking this relationship. So, we will do confidentiality now. We'll do like 2 or 3 questions from this paper. So, Robert is a 4th year medical student on his pediatric rotation. Today he's shadowing Dr. Patel, a consultant immunologist. One of Dr. Patel's patients is a 6-month-old baby who has recently been diagnosed with a very rare condition, whatever this is called, FOXN1 deficiency. It is a condition which weakens the immune system, and there have only been 9 reported cases ever. Robert wants to share the case with other medical students, but does not want to breach confidentiality. Alright, how appropriate are each of the following responses by Robert in this situation? So, number 1, send a WhatsApp message. Don't really know who uses WhatsApp anymore, but yeah, send a WhatsApp message explaining the case to a group chat of medical students, but remove the patient's name, age, and address. Okay, so social media and confidentiality is a big issue. Yeah, I'm probably going to go with very inappropriate in this case, because even though Robert is removing the patient's name, age, and address, this condition is super rare, and it will be pretty easy to track down who has this condition. So, not really maintaining patient confidentiality, therefore it's a very inappropriate thing to say. Number 2, do not discuss the case of any other medical students. So by doing this statement, or following what this idea is, you are maintaining confidentiality because you're not telling anyone about this patient. But then at the same time, medical students, it's good to share like medical knowledge around and your experiences. So it's not inappropriate because it's maintaining confidentiality, but then it's not ideal either because how are you meant to learn from this experience if you're not able to share it with other people? So yeah, appropriate but not ideal. So number 3, tweet about the case, removing the patient's name, age, and address. So, like we said before with the WhatsApp messaging, this does basically nothing to protect the patient's confidentiality because of the condition being so rare. So, a very inappropriate thing to say. So, the General Medical Council has guidelines on social media and what medical students can and can't do. And also there's Australian guidelines as well. Okay, this one's an easy one. So seek advice from Dr. Patel. That's very appropriate. So it's good that this student is asking for consent to discuss the case. But then what's not good about this scenario is the fact that he's not talking with Dr. Patel, because Dr. Patel is in charge of this patient and he's supervising this student. So although it's not completely bad because you are getting permission, it's not appropriate either because you need to be supervised by an actual qualified doctor. So inappropriate but not awful. Oh, here we go. Sarah is a third-year medical student on her GP placement. The first patient in the clinic is a 21-year-old student called Mike. He's been diagnosed with epilepsy. The GP informs Mike that he will have to stop driving for now, but then a few days later, Sarah sees Mike driving a car around campus. So, number 6, Mike's right to confidentiality. How would you rank this when deciding how to respond? So, like I said before, confidentiality is a top priority. And every patient has a right to confidentiality. So that is a very important consideration. That Mike could pose a danger to the public. So, like I said before as well, you can break confidentiality if the patient is a danger to themselves or to the public. So, if he's dangerous to the public, that's a very important consideration. I don't think this is important at all, because even though Sarah is a medical student, she still has to follow the same rules that doctors follow. So, it's not an important consideration. So she still has to follow all the confidentiality rules and all the professional requirements that all medical professionals follow. So, number 9. Sarah and Mike are both students at the same university. I think that's a little bit important because they may bump it. So if there's like an issue, they could see each other outside of the doctor's office. And as a result, there could be some sort of relationship, doctor-patient relationship issue or loss in trust with healthcare. So, but then at the same time, it doesn't really matter where you are, you still have to follow the guidelines that have been given. So I'm going to go with a minor importance in this case. So this is the third scenario. So Dr. Jones is a consultant in sexual health, currently working in a sexual health clinic. One of her patients, Mr. Smith, has recently been diagnosed with HIV. HIV can be transmitted in a number of ways, including sexual transmission. Mr. Smith has told Dr. Jones that he is still sexually active with his wife, Mrs. Smith, but has not told her about his diagnosis. So how appropriate are each of the following responses by Dr. Jones in this situation? Alright, so do nothing. So that's obviously a very inappropriate thing to say. So yeah, not lots of questions, but a few questions always give the option of doing nothing. And yeah, the correct response to these questions is pretty much always a very inappropriate thing to say, just because you're not really solving any issue by doing nothing. And you could potentially be doing harm to not only the patient, but also the general public, such as the patient's wife. So yeah, doing nothing is very inappropriate in this case. Number 11, inform Mr. Smith that she will have to inform his wife about his HIV status. Okay, I think this is option B, so appropriate but not ideal. The reason why it's appropriate is because you are telling Mr. Smith what is required of you. But then the reason why it's not the perfect response is because you should give Mr. Smith the option to tell his wife himself, rather than simply overriding him and going straight to the wife as a doctor. So yeah, appropriate but not ideal. So explain to Mr. Smith that he must tell his wife, or she, the doctor, will tell her. So pretty much a similar explanation to what I just said before. This is very appropriate because, number one, you're explaining the situation to Mr. Smith. You're saying what information has to be disclosed, and you're giving him the option to do it himself before the doctor does it. So yeah, it's a very appropriate thing to say. Boom. Tell Mrs. Smith about Mr. Smith's HIV status without telling Mr. Smith beforehand. Issues in this question is about confidentiality, giving out information without asking a patient's permission. So Mr. Smith is not involved in his care. You're doing it behind Mr. Smith's back. So inappropriate. Boom. Number 14. Inform Mr. Smith that she will have to inform his wife about his HIV status, but then tell one of the nurses to tell Mrs. Smith. Okay, what's good about this thing, this response, is the fact that, you're explaining correctly to Mr. Smith, but then what's inappropriate is the fact that the doctor herself is not doing it. She's instead handballing off the job to a nurse. And that nurse wasn't even involved directly with the patient's care. So as a result, you've just broken confidentiality with the rules I said before. So it's not completely inappropriate because you were doing the right thing by informing Mr. Smith, but then you're doing it in the wrong way. So we'll end review here. We'll get out of this place. And we finally arrive to honesty and integrity. Alright, so let's get my tips up. So, honesty. So, one important idea for this section is to realize that in the scenario, if the doctor or medical student makes a mistake or the patient is harmed as a result of an error, it is the treating doctor's obligation to apologize to the patient and explain the situation. So, the key word in that sentence being the treating doctor. So it is not appropriate to stuff up and harm the patient, but then instead of apologizing yourself, you handball it off to someone else to apologize on your behalf. So that's not good practice. So if that comes up in one of these scenarios, we know that that's an inappropriate thing to do in that case. And I only have one more point. So if you need to disclose information, it's very important to get the patient's permission first and explain thoroughly what information you're disclosing, the reasons behind it, and who you are telling. Alright, so we got Max as a CT1, working in an intensive care unit. One of Max's jobs is to prescribe pain relief to an elderly woman who was in severe pain. Max decides to prescribe morphine to help relieve her pain. However, after Max has given her the drug, she has a reaction and he realizes he has given the wrong dose. Max is able to stabilize the patient and she will not suffer any long-term consequences. While she is unable to communicate, her son is waiting to speak to her doctor. So how appropriate are each of the following responses by Max in this situation? So the first option, do not inform her about the incident, or her son about the incident. This is very inappropriate in this case, and the reason being is because you're withholding information. And when you make a mistake, it's good practice to tell the patient what's happened because it's their health. It's not up to you to decide. So, question number 2. Inform the son that a mistake has been made and give an apology. Yeah, so you're being open and honest. And apologizing is often a really good thing to do when you make a mistake. So a very appropriate thing to do. Number 3, report the mistake as a clinical incident through the hospital's procedures. Yeah, that's a pretty appropriate thing to do. So, yeah, following any sort of procedure that the hospital sets out is basically, it's always appropriate to follow procedure. So, yeah, that's pretty straightforward. So, inform the son that a mistake has been made and apologize. I think this might be a repeat of question 2 because, it's good to apologize and it's good to be open. So ask the FY2 to apologize to the son about the error. Yeah, so like I said before, this is I'm pretty sure either inappropriate, not awful, or a very inappropriate thing to say. I'm going to go very inappropriate because like I said before, handballing off the responsibility is a bad thing to do. So yeah, very inappropriate. Oh, here we go. So Jonathan is a 27-year-old cancer patient who has been diagnosed with an osteosarcoma. His doctor, Dr. Mike, has recommended chemotherapy and radiotherapy, which he believes is Jonathan's best chance to survive the cancer. However, Jonathan has been involved in online discussion boards and tells Dr. Mike that he wants to use alternative medicine. Jonathan believes that a combination of a vegan diet, essential oils, and alkaline water is deeply concerned, as he knows Jonathan is very likely to die if he does not undergo his recommended treatment. Okay, so number 6, Jonathan's right to make decisions about his own health. So I'm going to go off on a bit of a tangent here, but in university, medical school teaching, one of the key things they teach you is the pillars of medical ethics, and one of these pillars is the patient's right to autonomy. If the patient is able to make their own decisions and has correct decision-making capacity and is completely competent, then it's within their right to actually withhold life-sustaining treatment and just walk away. So, yeah, so that's a very important consideration. Number 7, there is no evidence to suggest that alternative medicine works. One of the one of the key things that doctors do is follow the evidence. So basically every treatment that a doctor gives has been backed up by research, so evidence-based medicine. So the fact that there's no evidence for alternative medicine in this case means that's a pretty important consideration. So we'll go with A. Number 8, that Dr. Mike knows that Jonathan may die without proper treatment. I mean, that seems important. That Dr. Mike knows that Jonathan may die without proper treatment. I mean, if you're looking at the other areas of medical ethics, one of them is non-maleficence. So making sure that no harm comes to the patient. So I'm pretty sure that's an important consideration. But I could be wrong though. The fact that Jonathan is 27 years old, how important is this? Yeah, I don't think that's important at all. One of the things that is mentioned in the resources that I've linked down below is the fact that it's very important not to discriminate against a person based on race, gender, or age. So age in this case is the key point. So we don't want to discriminate against them based on his age, therefore I'm going to go with not important at all. So I reckon that's enough questions for today. If you found this useful, feel free to like this video and subscribe to the channel, as I've got a few more videos that I'm planning on doing, which will cover the decision-making, abstract reasoning, and quantitative reasoning, which are going to be coming out in the very near future, as I'm on holidays right now. But anyway, check out the resources I've left in the description, but otherwise I'll see you guys soon in the next video.